Hi, this is Julie Lubinsky. I am the Associate Director for Digital for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to today's chat with Nurse Linda. I'd like to tell you a little bit about her. She's a leader and provider of rehabilitation nursing for over 40 years, most recently developing activity-based rehabilitation strategies. She also writes the interactive Ask a Nurse blog on our online community, which is an evidence-based community forum. We're also lucky to have her on a monthly basis with these webinars where she answers your questions. So now I'd like to turn it over to Linda. Hi, Linda.
Hello, and welcome, everyone. It's nice to be here with you again this month. I've been talking a lot on the blog about some common assessments, so I thought we'd talk a little bit about those, and then I'll answer some of your questions. I see somebody has their hand raised, and if you wouldn't mind typing your question into the box, then I'll be able to answer that question. So I'll look forward to that as we go through. But just a moment to talk about assessments. You know, you go to the healthcare professional, and immediately the first thing they do is they take your temperature, your pulse, your respirations, and your blood pressures, and they make these measurements. And so sometimes, you know, you go in and, gee, I know when I go in, somebody puts the blood pressure cuff around my arm, and they pump it up, and then down it goes. And I'm thinking, how did you get any kind of measurement that all happened so fast? And so I think sometimes people gloss over some of these basic measurements, but they really provide a lot of information, especially if you have spinal cord injury. So it's a good idea to know what your basic vital signs, they're called the vital signs because they're the signs that are vital to your living. So it's, you know, how your heart is working. It's an assessment of how well you're exchanging oxygen when you're breathing. So these are all very important figures to know for any person, but especially after you have spinal cord injury or any type of paralysis, and the spinal cord injury being either from trauma or disease. We talk about spinal cord injury, and a lot of times people think, oh, they're just talking about trauma, but it's a catch-all for trauma and disease as well. And it's a good idea to know what your normal vital signs are for you. You can assess your own vital signs if you have the equipment at home, or you can just use the information that you gather from when you're in the hospital or when you go to see your health care provider to find out what your usual temperature is, what your usual pulse is, what your respirations are, and what your normal blood pressure is. And the reason why you need to know these things is because after you have some kind of paralysis or especially spinal cord injury, or especially spinal cord injury with disease, there's a little progression where some of the vital signs tend to get slower depending on what level your injury is. Now, that doesn't mean that it's going to be harmful to you. That doesn't mean that this is a problem in any way. But after any kind of spinal cord injury, your vital signs tend to slow down a little bit, especially if you have a higher injury. If you have a lower injury, not so much, but especially with the higher injury. So what your normal vital sign is might be to a person who does not have spinal cord injury might be much, much lower. So let's just talk about blood pressure for a moment. So usually we say the average blood pressure is 120 over 80. Now the standards have been lowered just recently, and so a normal typical blood pressure is usually about 110 over the mid-70s, say. So it's been lowered a little bit, and so people are just, it's been for several years now, but people are just starting to get used to that, starting to understand that you need a little bit lower blood pressure than what we had previously thought. But after a spinal cord injury, your blood pressure might run something like 80 over 50. So if you go to the hospital in an emergency type of situation and your blood pressure is that low, they might say, oh my gosh, your blood pressure is so low, we need to get some IV fluids going and we need to build up your blood pressure, which would then be too high of a blood pressure now that your body has adjusted to your spinal cord injury. So you kind of need to know what that is. Now, there's the reverse side of that. If you would go into an emergency situation or you're at home and suddenly your blood pressure goes to 120/80, if you would talk to a healthcare professional or the EMT has to come to your house, they assess your blood pressure, it's 120/80. Oh, that's normal. Well, yes, that is an average typical blood pressure, but not in your situation. That would be a very high blood pressure if your blood pressure normally runs in the 80s over the 50s. So you see, it's that proportionality that makes a difference. So you need to know what your normal blood pressure is, your average. It is going to be, every time you take it, it's going to be slightly different. It'll be some variation. It might be like, 85/60, something like that. The next time it might be 82/50. And so you just kind of need to know where your ballpark average is. That's why when we talk about average blood pressures, it's usually reported in round numbers, because there's always going to be some slight fluctuation. If it's the time of day, if it's a different day, if it's a different month, if your body is cold, there's going to be all kinds of different fluctuations with your blood pressure. If you're feeling anxious or nervous, sometimes your blood pressure goes up a little bit. So you just need to know what your normal average is, and then you'll always be safe when you go and get the right treatment should you have an emergency situation. So we talk about autonomic dysreflexia a lot, which is a problem in the autonomic nervous system. The autonomic nervous system is the part of the nervous system that controls your body functions that happen automatically. So breathing, blood pressure, digestion, having your blood flow around in your body as it's supposed to. All those things happen automatically. Your kidneys function automatically. You can't, by your mind, make that start and stop. It just happens. Your liver functions automatically. So when you have problems with the autonomic nervous system, what happens is that sometimes it gets a little goofed up, in that messages below your spinal cord injury are trying to be communicated to your brain. So something's happening below the level of your spinal cord injury. It's trying to get that message through to the brain, but the message can't get through. So there's a lot of signals that go through your body. So you get a message in your brain, something's wrong, but the brain can't interpret it correctly because it's not coming through correctly. So your blood pressure tends to rise, and that's an adjustment of the autonomic nervous system. That's why it's called autonomic dysreflexia, because there's a problem there. So if you would go to the hospital, or if you have symptoms of AD, you might find that your blood pressure might get up to 120/80, or maybe it'd be even 130/86, something like that. Well, somebody assessing that blood pressure would say, well, that's a normal range. That's nothing to worry about. But for you with a spinal cord injury, it might be something very much of concern. So parameters are a little different depending on your condition. If it's spinal cord injury or if it's any other diagnosis, sometimes affects your blood pressure. If you're having your pulse checked, here again, sometimes people check your pulse. It happens pretty quickly, but there's so much information that's gathered just from that slight little feel of the pulse and the wrist. So if there's any kind of missed beats or skip beats, you can tell that right away. You can tell if somebody's pulse is bounding, or if the blood's just racing through that artery very quickly, or if it's kind of a thready pulse, so it's really kind of difficult to feel and tease out. So those are just some of the pieces of information. The pulse gives a very good idea of how your heart is functioning at that particular point in time. Knowing your average pulse is an important little piece of information, because there again, if your heart is speeding up and racing, it might be, after spinal cord injury, it might be what would be an otherwise normal or typical pulse. So your pulse might be quite fast, or sometimes after spinal cord injury, especially with the higher levels of injury, your pulse can become very, very slow. And so sometimes you might need some medication or some other type of intervention to speed your heart up a little bit so you're getting enough blood pumped around your body. When people assess your respirations, they usually do it while they're taking their pulse. I guess that's kind of a healthcare secret that I'm giving away. But they want to look at your chest rising and falling. They want to see how you're breathing, and they will count your respirations. But they don't want you to know that they're doing that, because respirations, even though they're automatic, they happen through the autonomic nervous system. Your body will force itself to breathe, but you can turn that on and off for very short temporary periods. So you can hold your breath for a few minutes. But if somebody's watching you breathe, you might breathe a little bit faster, or you might breathe a little bit slower. So you kind of check those respirations when the patient is not really aware that you're doing that. You get a lot of information from breathing, and now they'll put that little clothespin on your finger, which will measure your oxygen, so how much oxygen's getting through to those fine capillaries in the tips of your fingers. So that's very far from your heart, your toes even farther from your heart. So that's a good assessment to see how your blood is exchanging that oxygen and make sure that everything is working properly there. Now, if you're using mechanical ventilation, of course your respiration will be whatever the machine is set to be, and that's okay. You just need to, be sure that you're breathing enough, that you're getting enough oxygen in, letting enough carbon dioxide out of your body so that all of that is functioning. Now, with respiratory assessment, you can also look and see if somebody's really having a lot of trouble getting their air in. So if they're using a lot of their what we call accessory muscles. So when people breathe, you usually see their chest moving up and down just very gently. That's mostly the diaphragm working and the lungs expanding and contracting. But there are other parts that help you breathe as well, other body parts. And one is that in between each rib, there's some little tiny muscles in there, and those muscles help expand your lungs as well as your diaphragm. If you look at around somebody's neck, you can see if they're using a lot of these accessory muscles to help their lungs expand and contract. And then the abdominal muscles are also very effective in helping people breathe. And so people sometimes forget that. They think, I have a lower level injury. My lungs are not affected because they're above my level of injury, which is all true. So they're working fine, your diaphragm's working fine, but you really use a lot more of your abdominal muscles in breathing. Certainly the diaphragm's the primary breathing function control unit there, but your abdominal muscles are also used to help make changes in your chest cavity. So as you're breathing, your abdominal muscles are working as well. So sometimes people think, I have a lower level injury, it doesn't matter, but it does matter because you're missing out on that third little piece to breathing. So a lot of those factors play effect, and we certainly want you to have enough oxygen exchange. Then the other vital sign that's checked is temperature. And as you know, temperature plays a key role in individuals who have spinal cord injury, because what happens with temperature is that, again, that's the heat that's put off by your body due to your metabolism. So people who are living have a temperature, and you can have a high temperature or lower temperature. If you have an infection in your body or your metabolism is working very quickly for some reason, that tends to produce a higher body temperature. If you have a lower body temperature, your metabolism isn't really working that effectively because you're not generating enough heat, so your metabolism isn't building up enough energy for your body to really function well. So looking at temperature is very important. Another thing about temperature after spinal cord injury is that because it's controlled by the autonomic nervous system, sometimes temperature is affected in such a way that if you get overheated, you then are not able to automatically cool your body. So as you get warmer, if you go outside, we're having a lot of humid weather and warm weather, and so as you go outside, what will happen is your blood vessels will expand to allow more blood to circulate closer to the surface of the skin, which will help cool the blood. If you get colder, your blood vessels contract, so more of your blood circulates in the core of your body where it's warmer. The autonomic nervous system can kind of get confused with this after a spinal cord injury, and it doesn't control so well. So going out in temperature extremes can really kind of mess up your body's metabolism function through this temperature until you get your body cooled or get your body warmed. Sometimes people have trouble with the automatic functioning of their body temperature, that they really can't get that autonomic control over their temperature until they go to sleep. And then the brain is resting. You know, when you sleep, your brain rests and recharges, and sometimes that will reset that autonomic nervous system. So sometimes people who get too hot or too cold, they'll just want to sleep a little bit to, you know, kind of reset their body temperature. Now, you have to be careful with that, especially in this warm weather that we're having, because when people get overheated, if they have a spinal cord injury especially, but even if they don't have a spinal cord injury, people will get very lethargic and they don't move very much. They really have this need to sleep, and that's getting into things like heat stroke or sunstroke. And so you have to be very careful, because you don't want to get into any of that, not being able to really regulate that or not being able to cool down your body with adjusting the blood vessels, or sweating is another thing. Sweating cools your body. So if you get really hot, you'll start to sweat. So these little beads of perspiration will come out in your body. You don't want to wipe those beads of perspiration off, because more perspiration will come out. This is the body's cooling mechanism, so as long as you have sweat on your body, you want to leave it there. If you keep wiping the sweat off, you're going to dehydrate yourself, because more sweat's going to come out. Wipe it off, more sweat comes out, and eventually you can dehydrate. Of course, after spinal cord injury, a lot of people, the majority of people, do not sweat below the level of their injury. And so if you can't sweat, your body cannot cool itself off. So you need to take precautions to sit in the shade, be very leery about knowing the temperature that it is outside, because in these really hot days, your body can get really overheated very quickly. And the other thing you really need to pay attention to, which a lot of people forget, is the humidity. Temperature, you can move to a different temperature and your body will adjust to the different temperature, but humidity accumulates in your body. So even if you move to a cooler place, the humidity might still be building in your body. So you have to be very careful about those things. If people do want to go out and enjoy the nice weather, we recommend that people will take towels from the bathroom, put some cold water on them. Usually people will keep them in a cooler so they can put a cool towel over their body to help keep them cool. If you're feeling at all overheated, you might periodically want to sit in the shade or the air conditioning, drink a little extra fluid, and you can also get these water bottles that spritz you, or these little battery-operated fans, which are very helpful to keep a breeze going over you. So all important things, and just some things that you need to think about, because in this hot weather, and of course you want to slather your body with sunscreen, and that goes for everybody, spinal cord injury or not, because the ultraviolet rays from the sun will really give you a sunburn in no time at all, and that you really don't need. None of us need a sunburn. It is an injury to your skin and can cause damage. We all know that increases your risk for skin cancer. So that's the same for all of us. And the other thing I always like to remind people, besides wearing their wide-brimmed hat, is to wear the UV-protected sunglasses. So when you go to the store, you're going to buy a new pair of shades, be sure and look for that UV sticker. You might have to pay $1 or $2 more for those sunglasses, but protecting your eyes is very important, so it's worth that money. I'm not one that really likes to recommend products because, I don't like to spend other people's money. I'm always looking for something on the cheap. But if you do have some extra funds, or if you're thinking about something that you might want to put on your wish list, something that's really very nice that I see a lot of people use are these remote car starters. So you can't do this if your car is in the garage because the exhaust will build up and it can filter through your house and make people sick. And sometimes I've even heard of people dying from their car running in the garage and the garage door is closed and then it comes through the ventilatory system. So if your car is outside, parked outside, and you have one of these remote starters, you can start the car and get the air conditioning going and get that car cooled down. If you have somebody who can start your car for you and let your car cool down, because that car in the summertime, you hear about these children and pets that have been left in the car and how terribly devastating that is. And so, think about yourself and either get the car cooled down before you get into it because it's collected all that heat in there, which is then going to collect in your body. They're also nice, the car starters are also nice in the wintertime because then you can get the car heated up before you go in there. But especially in the summertime, you know how hot it is in those cars that have been sitting out. So be sure and think about those kind of things. That is an extra bit of money. So, you can do the same by having somebody else start your car or keeping it parked in a cooler place. So just something to think about. We're going to go through some of the questions now. And so I do see that there's another hand raised. If you wouldn't mind just typing your question into the box, and then I'll be able to get to your question. So the first one that's listed here is, here's a person who's T7, complete 31 years post-injury. So that is a long time, and I am hopeful that you are in some of the chat rooms because after 31 years you figured out how to be successful, and so it's always nice for some of the younger people who've just recently been injured and talk to you. So I bet you have a lot of valuable information. So this person says they've been having some trouble with dehydration type symptoms like dizziness and blurred vision, and believe caused by lack of water, but also happened once when I had an overfull bladder. So dizziness and blurred vision, the first thing we think about is autonomic dysreflexia. Now, T7 is just below the cutoff line where we say people have AD and people who don't. So you could easily be right on the edge there and be having autonomic dysreflexia even after 31 years, because you know why? And this is a hard pill to swallow, but this is for all of us. After our body starts aging, it tends to change a little bit, and so maybe your younger body was able to accommodate for the AD, but now a little bit older, not so much. There are some people who have been reported that have AD who have injuries as low as T10. So this very well could be happening to you. So first of all, you need to check your blood pressure and see if your blood pressure is raising, going up while you're having some of these episodes. Check to make sure your bladder is empty, that your catheter is not kinked. If you have an external catheter, make sure it's not twisted. Make sure the leg bag's not overfilled. Another thing is it can be, AD can also appear because of bowel impaction or diarrhea if you ate something or had the flu. It can be by clothes being wrinkled, sometimes even just the breeze blowing over the fine hairs of your legs can set off AD. So be sure and check that. That's life-threatening, so you want to be sure and rule out AD. Talk to your health professional so that for sure is ruled out. Now, the other thing, though, is, that you've identified it as maybe it's a lack of water, and that could very well be, especially in these hot days. And people usually control their intake very carefully because of their bladder program. And at T7, you're probably doing your own catheterization. So you see, you're probably very careful on your intake. So you can increase your intake just a little tiny bit. Sometimes we say increase your intake, and people, oh, okay, and they go have 8 ounces of water. No, not that much. Just increase your intake by 1/4 to 1/2 cup in between meals while you're awake. And that will increase your intake just enough. It shouldn't affect your blood pressure, shouldn't be a problem for your heart. If you do have any kind of cardiac problems, be sure and check again with your health professional to make sure. But you can increase just by a tiny, tiny little bit. Don't be overzealous with increasing your water intake. So when I say that, I mean just increase it by, just 1/4 cup, maybe between breakfast and lunch, and between lunch and dinner. And then if that goes well and your volumes aren't changing too badly when you're catheterizing, maybe you can go up to an extra 1/2 cup in between those meals. So it just gives you a little bit more. Another thing is if you're outside, use some of those techniques to cool yourself off. So it could be a problem with dizziness and blurred vision, could be lack of water. Now, if you're inside and you're having dizziness and blurred vision, I know a lot of people, everybody's on the computer, including myself, 24/7. Something that I am hearing about, I've only found one article in the literature about it, and it was from a woman in Scandinavia that was doing a study. There's something about the computers and the backlight on the computers. Now, maybe you've been using a computer for a number of years and you've never had problems, and all of a sudden this is happening. So if you find that it's related to computer use, it could be the backlight on your computer. If you've gotten a new computer or a TV or even a telephone, if you're on that a lot, something about the lighting, there's surges behind the scenes that we don't perceive with our eyes when we're looking at the screen. We look at it, it's fine, nothing's going on. But there's these little kind of micro surges that are going on behind the screen. So if you find that your dizziness and your blurred vision come from that, it is a trigger for autonomic dysreflexia. If you're on the computer too long, if you're watching TV for too long, or if you're on your cell phone looking at that. So I see a lot of people who have it, but I haven't seen a lot in literature about it. But I've seen enough that I believe that that is probably true. So so think about those things when the dizziness comes on, when the blurred vision comes on, and what activities you're doing. And so what you describe in your message here is classic symptoms of autonomic dysreflexia, but there again it might not be. So I'd check the autonomic dysreflexia first and then start looking into some of those finer reasons why that could be happening. The next question is about somebody wants to start a bowel program and would like to know what type of medication to help soften the stool and make it easier to pass. Well, there's several things. One is to consider fluid. The more fluid you drink. Now, I don't know if you're catheterizing, but usually if you can drink more fluid, that certainly helps make the bowel softer. Also, look at your diet, and so we always say roughage, roughage, roughage. You know, there's a commercial on TV where this lady's working and she's eating roughage 24/7. Well, of course, we can't all do that. But think about if you can add any more fiber. Look at your diet. If you're eating a lot of processed foods, can you add more vegetables in there? Especially raw vegetables will help make the stool softer. You can buy what's called fiber laxative. it comes in a powder or it comes in cookies. There's several different ways. There's also pills that you can take, but you have to drink a lot of water to make the fiber active, because if the fiber doesn't expand in your bowel, it just becomes hardened and impacted. So you have to drink a lot of water with these. There's many flavors, and there's even some that come in completely flavorless, and you can put it in water and you don't even know it's there. So that's helpful. And then also you can go to your pharmacist, and behind the counter, you have to ask for it. It's not out in front of the counter. But behind the counter is some stool softener, and the generic brand costs about, I think, about $2.50 for 30 capsules or something. And you can take the stool softener, which will help as well. Now, don't take all of these all at once. Don't start one day and just take here's everything she said. Choose one that you think fits best with what you're doing. Check with your healthcare provider or your pharmacist, because even though this is over-the-counter type of medication, it could still react with some medication that you're taking, or it could be contradictory to some medication that you're taking. So always tell your healthcare professional and your pharmacist every kind of medication that you're taking, if it's prescription, if it's over-the-counter, if it's from the health food store, whatever, be sure and tell people about that. So just start with one, because if you take, like say you'd want to do the fiber and the stool softener, in a few days you'll notice that that is too big of a dose for any person. So just start with one, and you'll see the effects of one. If you need to add more later, like 6 weeks later. But check and just start with one, because you'll find that any one of these things will make a difference. And so you don't want to overdo it and be in the situation where you're having some diarrhea. So that could be hampering a lot of your activities. Okay, the next question is, could my feet swelling be a sign of UTI? I really had to ponder this for a while, because usually feet swelling is a result of what we call dependent edema. Your feet swell because they're down below your body when you sit in a chair. And so usually what happens is the way that we get fluid out of our legs is we use those muscles in the legs when we're mobile. And so people who walk will not have so much edema in their legs because their muscles are massaging their legs and bringing the fluid back up. However, if you don't have functional use of your legs, you can do passive range of motion to help bring that fluid up, or raise your legs when you're sitting in your chair. If you can stretch them out and put them up on a footstool, or when you get in bed, when you put your legs up and then they're even with your heart when you're laying in your bed. So there's a line, an imaginary line, so your body's laying absolutely on the mattress. Even if you put a pillow underneath, put the pillow long ways underneath the calf of your leg so that you're raising your feet up higher than your heart, that will take care of the edema in your legs. Some people have extreme edema, and sometimes they will need ACE wraps or support stockings, elastic supportive stockings. Now, if you do ACE wraps or supportive stockings, you'll want to put those on early in the morning before the edema collects in your legs from being dependent or hanging down. So you don't want to put those stockings on and then trap the edema in them. So put them on when your leg's at the smallest. You have to measure your legs because the elastic stockings come in various sizes. And if you're doing the elastic wraps, ACE wraps on your legs, whenever you put an ACE wrap on, you always start from the point furthest away from your heart. If you go backwards the other way, you're trapping the fluid more in your feet. So you always start from the toes and then work up the legs. If you're doing your hands and your arms, you start from the fingers and work up the arms. So you're always going towards the heart. Now, sometimes that fluid will then move and shift to another place. So if you lay in bed a lot, sometimes that fluid will leave the feet and it'll collect kind of in the small of the back, and you'll get you can touch the small of the back, and it kind of almost jiggles like gelatin because there's so much fluid in there. So you don't want to move it from one place to another. You really want to get rid of it. So hopefully putting your feet up and using some of these techniques will help that happen. It's not usually an indicator of UTI. UTI is usually noted by burning if you have sensation. If you don't have sensation, you might notice a different color to the urine. You might see some kind of white strands in there, not to be confused by sediment. Sometimes when the kidneys filter the blood, they take some sediment out of the blood, and it tends to collect in the bladder, and so people catheterize and they see this kind of white substance come out. It looks more like a powdery substance, and that's sediment, but you might see some strands in there. The only real way to tell if you have a urinary tract infection or not is to have a lab test, a urinalysis, to see if there's bacteria in the urine. Because sometimes for many people, spinal cord injury or no spinal cord injury, they might have a UTI, especially women. They might have a UTI and have no symptoms at all. So usually the symptoms of a UTI are fever. You might feel sweaty or clammy above the level of your spinal cord injury. If you have autonomic dysreflexia, a UTI can trigger that. But the only real way to tell is to have a urinalysis done. And then so if there's bacteria in there, then they'll continue with a second test. And the second test is to do a culture and sensitivity. When you have a urinary tract infection, it can be any kind of bacteria, and so you need to have the antibiotics specifically for treating that particular kind of bacteria that you have in your bladder. Sometimes if people have had many urinary tract infections, the doctor will know, well, you have a urinary tract, and I know that this works for you, and they'll do that. But bacteria tend to morph and change. And so once they become accustomed to one antibiotic, they'll change into something else, and that's why you have to take the antibiotic for the full course, even if you feel better, or even if you think, oh, no, it's gone after 3 or 4 days. No, you have to take the full course of antibiotic to really rid yourself of that urinary tract infection. So probably the swelling in the feet is more a sign of dependent edema. So it's from having your feet hanging down all day while you're sitting. Next question, I do have intermittent catheterization, have been getting UTIs within a couple of weeks of completing antibiotics for the prior infection. Are there any proven techniques to prevent infections? Well, there are some techniques that have been demonstrated. Washing your hands and washing the opening to your bladder is going to be a very key issue. Now, when you wash the opening to your bladder, you want to use, people will generally use soap and water. However, you must rinse the soap off before you put the catheter in, because sometimes the soap gets connected to the catheter and then it's up in the bladder, and that's a real irritant. So when you're in this kind of situation where you're having one infection after another, people at home usually do the clean technique. You might want to talk with your health professional about using sterile technique or changing the type of catheter. There are some catheters that are available that are touchless, so you never touch the catheter at all. You still have to clean the opening to your bladder. Sometimes people will use the little scrub that comes, the cleaning solution that comes within the catheter. Sometimes that's too drying for the delicate tissue opening the bladder, so you might have to use something else. So talk to your healthcare professional. If you've had depends on your insurance, or if you're using the Medicaid system, there are different rules depending on what your individual payer says. But if you have so many infections that in a certain amount of time, then that usually will indicate that you can move to a higher level of catheter, meaning more expensive type of catheter with more features, like the touchless or the pre-lubricated catheters. So that would be a strategy that your healthcare professional would then be able to write a letter to your payer explaining what the situation is and how you've had these infections, and so then that usually gives you a bump up in the type of product that is being paid for by your payer. So usually what type of product you use is, I don't want to use dictated, but it's almost dictated by your payer, because unless you have a bottomless pit of money, all of this equipment and supplies is very expensive. So usually people use what the payer allows them to have. So if you've had a number of urinary tract infections, it's time for your healthcare professional to solicit your payer. You can talk to your case manager through your payer, but generally what you'll need is you'll need that prescription from your healthcare provider, and they'll need to write the letter so that everything's in there. And it's usually, if you have documented urinary tract infections with treatment, it's usually not too awfully difficult to get an upgrade in your catheterization supplies. Now, something you want to work very carefully with your healthcare provider, because they will send the letter to the insurance company, but the response from the insurance company will be mailed to you at your home. So they don't necessarily, even though the healthcare provider sends the original request to the insurance or the Medicaid office, the response from them will come to you because you are the owner of the policy. So you could get a letter and you think, oh, okay, so this is what's going on, but your healthcare provider has not received a copy of that. So the minute you get that letter, you need to take it to their office or call them up or scan it and send it to them so they can see what's going on. Sometimes when you request something from insurance or Medicaid, the first line is a denial, and then it has to go through the second approval. That's just one of the ways that the system works. And but usually it's not. If you have the documented evidence and it's in your policy, then you'll be able to get these not without too awfully much difficulty. So that would be something to think about. Other than that, it's really it's technique. But even if you're using the best technique, sometimes that bacteria gets in there and it's living in there, and it's real difficult to get rid of. Another thing to think about is to increase your fluids just a little tiny bit, but getting that flushed out. And something that people overlook, which really helps a lot, but it's not a quick fix, is moving more. So if you can use the James Bond method of bladder care, shake it. He does that martini. I like it shaken but not stirred. So if you can move your body, whenever you move your body by doing a pressure release, rolling side to side in bed, bending your body forward, or moving side to side in your chair just a little bit, you're shaking your bladder. You're also stimulating your bowels to work. So the more movement, if you do passive range of motion and you can move your legs around, or have somebody put your legs through the range of motion, that's stimulating that abdomen, and that's shaking that bladder up. And so that gives bacteria less time to clump together or clump against the side of the bladder wall where it loves to live and multiply. So there's many things that you can do, but probably if you've had a significant number of UTIs, then you can get a different catheter system that might help you out. But in the meantime, doing strict hygiene with your catheterization, and moving around will certainly help you as well too. So the next person says last year they broke their hip and nearly died at home with no bowel or bladder care, would not accept an indwelling catheter or colostomy bag, and just needed help for a few weeks. I was told the family does that, but I live alone. Well, let me tell you, families don't necessarily do that. There's a lot of people with family that don't do that. Usually we encourage people to take care of their own bowel and bladder if they have the hand function. If you don't have the hand function, but you live alone and you needed somebody to help you with that, then you could have, I would assume you could have had a home health nurse. Now, this is all hindsight, and so I don't know why that didn't occur. Another thing that happens sometimes is that people will temporarily use long-term care or assisted living just for a temporary, when they're in such a situation. So sometimes I have people that break their wrists for whatever reason. They can't do this, or they have surgery on their hands or maybe on their shoulders from problems, and they might use a temporary long-term care facility, or they'll have home health come in and help them with the things that they can't do. So an indwelling catheter could have been temporary. The colostomy would be another surgery, so that would be a different kind of thing. I'm not sure I understand why that would even be suggested. But to leave you there without any kind of services kind of puts you in a really tough place. And you cannot go for a couple of weeks without catheterizing or doing your bowel program. And that really, as you say, it really affects your health. And so if there should be any kind of assistance that could be provided because of your change in condition with the broken hip, until you get that range of motion back that you're able to do those things on your own again, that just is kind of leaving you hanging out to dry there. So that would be the thing, is to check and see if there's any kind of attendant or services that can come in. Medicaid will usually pay for something like that, especially if you have this temporary situation with your hip. But basically, we encourage people to do those things on their own. Now, I realize with your fractured hip, you didn't have the mobility to do that. So, it's time to get some extra help in there to help you do those kind of things, because they just have to be done. You can't just let your bladder fill and never empty, because that will affect your kidneys and your bowels. That would be an impaction. So, yeah, that's a disaster waiting to happen. So see if you can get home health aid. If you talk to your healthcare professional, they should be able to get one in there like this afternoon. Those things move pretty quickly when you're in that situation. So that's something that should be provided for you. The next question is, why is there white mucus in urine every time I get a UTI? That's probably the bacteria in there. If it's only there when you get the UTI, sometimes people get mucus in their urine, and it really doesn't mean anything. But sometimes when you get that white mucus in there, that is the clump of bacteria that you are seeing there. So that's a good indicator. When you see that white mucus, I've got a good UTI, I've got to get some help for that. And you don't want to let the UTI go for any length of time. You want to get treatment for that right away, because if you capture and kill the bacteria before it's mutated and allowed to grow and multiplied in there, then you have a much better chance of getting rid of that. The longer it's in there, the more difficult it is to get rid of. The next question is, as somebody with an SCI, what's something I can do to reduce swelling in my calves, ankles, and feet? Any tips and or tricks are greatly appreciated. Well, that's that dependent edema. So elevating your feet higher than your heart. When you lay down in bed, make sure that your legs are elevated a little bit higher than your heart. You will notice that when the edema starts, when you lay down and the edema starts coming out of your leg, you will notice that you'll need to catheterize sooner. So sometimes people go to bed, they wait a half an hour, and then they do their last catheterization because of this fluid coming up. The other thing is to try those elastic stockings or ACE wraps, and if you can during the day, put your feet up so that they're not hanging down over the side of your chair where our feet belong. But, see if you can elevate them on a little footstool or something. And if you can, do range of motion, because that's going to help stimulate that fluid to move back up and out of your body. I see we have another hand raised. If you could put your question into the chat box, then I'll be able to read that and see it. So here's a question about bowel program. Why is my colon and stomach so slow? Well, that is because of the spinal cord injury. And so what's going to happen is that you have to do the digital stimulation to stimulate the bowel to function more quickly. Some other things that you can do is before your bowel program, you can drink some hot fluid, which stimulates the bowel to work. There's something called the gastrocolic reflex. It's in all of us, and you still have it even after a spinal cord injury. So when the bowel starts to feel, the bowel works all the time, but when you ingest food or warm, hot fluid, this gastrocolic reflex goes into overdrive, and the bowel starts squeezing and working a little bit harder. So those are some things that you can help to do. But after spinal cord injury, you're going to have to do some suppository and some digital stimulation so that you can get the stool out. If you don't have abdominal muscular function, if that's been affected by your spinal cord injury, you're probably not going to be able to push down. Something that we do see in women who are having babies is you'll see like a trapeze type of thing that women will pull on, and that changes the pressure in the abdomen. Most of us don't have a trapeze type of thing in our homes unless you have one over your bed. That's certainly not over your toilet. But if you do a push-up on the toilet, if you have some handlebars on the side of your toilet, and you do a push-up, that changes the pressure in your abdomen a little bit. That might help, but basically it's going to be the suppository and the digital stimulation. For those of us old-timers who use indwelling catheters, is there a brand type you would recommend? Well, again, this is the kind of thing where most people use the best catheter that their payer affords for them. So if you're an old-timer, you probably remember the red rubber catheters. And so for people today, it's hard to imagine, but for those of us that are a little bit more mature, let's say, back in the day, people were given a red rubber catheter, and you used it for the whole month. You sterilized it in a pan of boiling water on the stove, and this is just the way catheterization was done. Nowadays, people use the catheter once and they throw it away, and so we've come quite a long way. So if you're using the old red rubber, you can probably upgrade to a single-use catheter. If the old red rubber is working for you and you like it, then go ahead and do it. If you're not having urinary tract infections and you've mastered that, if you want the single use, you can probably talk to your healthcare professional, and you could probably get one of those now. There are all kinds of catheters that are available on the market. If you go to the web page or you write to the catheter company, there's Bard and I'm trying to think of Hollister is an excellent company as well. And there's some smaller companies too. If you write to them and ask for a sample pack, they'll give you a whole variety of different kinds that you can try out and see which one really works best for you. So you find one in the sample pack that you really like. The problem is if your insurance company doesn't pay for it, unless, like I say, you have a bottomless pit of money, you're not going to be able to afford that. So, it's kind of a good thing. It's kind of a bad thing. If you really like one, you can talk to the company. They have representatives that have sample of these letters that your healthcare professional can send. It's very difficult to get an advanced type of catheter and get it paid for. You can get one. Anybody can go buy one. But to get that kind of paid over the long term is really kind of difficult to do. So talk to your healthcare professional. I mean, there's all kinds of catheters that are just very exciting to see, and you think, wow, this is really the answer, and it indeed very well may be, but it depends on if your payer will continue to pay for that over the long term. So, that's ultimately the reality of the situation. So hi, I see Lin Chi Hoing is from Vietnam, so welcome. I'm glad that you're able to join us today. Here's the next question is, what product in drugstore is the best barrier cream? Well, if you're looking for bowel barrier cream, so if you have some reddened area around your rectal area, a lot of the diaper type barrier creams are good. There's butt paste. It's literally called butt paste. There are some other brands that are very good for keeping stool from eroding your skin. Now, if you're looking for a urinary type of barrier, you'll want to get one that's specific for urine. You do not want to put rectal cream on the opening to your bladder, because that's just inviting infection and trouble to come in. If you're wearing an external catheter, if you're male and you're looking for something to protect your skin while you're wearing that external catheter, because as you know, when you void, the urine collects in the sheath that goes around the penis, and that tends to excoriate the skin. So be sure and look for urine protectant if you're looking for that type of situation. If you're looking for something for your bottom, then you can use some of those other types of diaper protectant. But if you're using it to put on the skin of your penis, then you'll want to get a urine barrier product. And then it goes down to personal taste, what you like, what works best for your skin, because we all react a little differently to different products. Okay, here's a good question. What emotional support can be given to a 28-year-old spinal cord injury to get back into the workforce and education if they're medicating themselves? So it seems to me like at 28, people, are ready to be involved in their lives most often, not always, but most often. So if somebody is having trouble getting back into that, it could be because of some sort of depression. If they're self-medicating, that's usually one of the signs that, they're just having some trouble adapting to spinal cord injury, and let's face it, we all know that's a pretty tough adjustment. So it's, if they're self-medicating and they're having this trouble, it's time to get some professional help in there, and you can maybe start that with the primary health care provider. Self-medication can lead to lots of complications and problems, and so you want to really get on top of this. Now, sometimes people say, oh, I don't need that, but sometimes it's just the family member, the person who's interested. Like, this sounds like it's somebody writing about someone they know. So it's time to really look for that professional help. Now, we've had several people that have written in that have had spinal cord injury for a long time, and of course, I know of no one who's ever said, "Gee, I can't wait until I have a spinal cord injury," It's one of the toughest things that can happen to a person. And, to say that, that people just, well, okay, I'll be paralyzed now and I'll just move on. That doesn't happen. It takes a lot of time to get adjusted to it, and even after you get adjusted to it, you still have that rubber band that lets you get out so far and just draws you right back into that depression. So maybe some medication might be in order, but there again, this is such an individual situation. Sometimes if you can get the medication started, that would help open up a person to even being able to go and talk to other people. If you talk to the Christopher and Dana Reeve Paralysis Foundation has a peer support program. That might be a good place to start. They also have Dr. Dan, who does webinars and has a blog about adjustment to spinal cord injury. We've had several people who have had spinal cord injury for quite some time. I'm sure that they would be very knowledgeable about the ups and downs of spinal cord injury, such a life-altering event. So I do hope that you'll seek some help for this person, because 28 years old, it's got a lot of life ahead of them, and hopefully they'll be able to enjoy it to their fullest ability. So it's really getting into that mindset and kind of changing that mindset. So I hope that you'll seek help right away. Here we go with another one. My son moves his upper limbs but cannot hold a pen. Is that movement real? He's diagnosed with complete injury. So if he cannot hold a pen, but he can move his upper limbs, well, holding a pen requires a lot of fine motor movement. Moving your upper limbs is more gross motor movement. Now, there is something called the universal cuff, which is if you have some arm movement but no hand or finger movement, there's a thing called a universal cuff, which is a strap that fits around the palm of the hand, and it has a place where you can put in a pen, you can put in a fork, you can put in a toothbrush. So there's all kinds of things that you can do with that universal cuff. So that would be a good opportunity to try to use some of that. So I'm afraid we are past our top of the hour, but I hope that I've answered some questions. There's still a lot of questions left, and so if you would like, you can write them into the blog, or I'll be with you again next month, and I'll look forward to that. I'm sorry we didn't get to all the questions today, but it's been wonderful spending this time together. So with that, I'll turn it back to Julie.
Great. Thank you, Linda. Again, if you would like to leave Nurse Linda a question, you may do so by joining our online community. You can visit christopherreeve.org/nurse, and she will get to your question. She usually checks out our community every Wednesday from 8 to 9 p.m. So please look for the next live chat with Nurse Linda at the end of next month. You can look for it on christopherreeve.org. And thanks all for coming. We'll see you next month.